Full is notorious for creating a low sodium. So saline would be the fluid of choice. And if you don't get that sodium back up on that little ruptured bladder, and the little fall, try to do anesthesia on it, you'll kill it because the heart can't take that. And the other place it's used around the hospital is maintaining catheters and a little fluid in there to keep them from clotting. So that's the reasons, that's where you use it, and that's why it has limitations. Now, there's other solutions that are even better, and so those are the ones that are probably around the hospital. Let's look at what they contain. You really need to know what they contain. All right, there's two. The first one is Plasma-Lyte, and Plasma-Lyte A, and it's made by Abbott, and it's made by, this one's made by Baxter, I'm sorry, made by Baxter, and it contains, see, if you look at that profile, it's almost like serum. That's what they're trying to do. So it's got 140 milliequivalents of sodium and 5 potassiums, and it's got magnesium in it. And then look at the chloride. Instead of that 154 for saline, it's 98. And it's got two other things that aren't in normal serum. It's got this drug called acetate, sodium acetate's what's used, and it's got sodium gluconate. And if you look on the bag, that's what it's going to say. It's got 27 milliequivalents per liter of acetate and 23 of gluconate. Oh, okay, well, we'll find out what they are in a minute. What is the pH? Well, normal pH in the blood is 7.4, and look what they do. They buffer it to make pH 7.4. So it's not going to change the pH or the acidity of the blood and plasma. Look at the osmolarity. The osmolarity is 294, just right normal. That's what you want, and that's what you expect because that's what they created. All right, well, there's another one, and it's called Normasol. And this one's made by Abbott. Look, it's Normasol-R. The reason they put the R on there is for replacement. It's a replacement of the serum electrolytes. And look what's in it. Looks like the other slide, doesn't it? So here we've got two companies, the biggest fluid manufacturers in the world, both making exactly the same solution, but under different trade names. And so there's a message there. The message is, since they're both reliable companies, and because they're both exactly the same product, what do you do as a purchaser? You buy the cheapest one. So whatever's on sale is the one to get, because they're the same. So why would you want to pay more for the same thing? All right. And again, it's got acetate and gluconate because they are the same. So let's see what that, so first is that the composition is exactly the same, and they're just different trade names. All right. Oh, I thought there was supposed to be a slide. But let me tell you about it. I think it's in there somewhere. Maybe it's out of place. But we'll go on. But and if it doesn't, I'll come back and tell you. Ringer's lactate solution. Lots of people still use Ringer's lactate solution. It was made by Dr. Ringer. That's why it's Ringer's lactate solution. It was also called Hartmann solution, so you'll see that name in the different ways. And here's the deal, okay? It is a lot like serum electrolytes, but it's a little low in sodium, and in it they put some calcium. So the difference is it's got calcium. And the chloride's a little bit higher than normal, and instead of acetate and gluconate, it has lactate. And so lactate is a normal product that's in the blood, but it's not usually in high concentrations. But Dr. Ringer and Hartmann decided that they would use lactate instead. Notice that the pH is a little acidic. It's down below 7. Notice that the osmolarity is a little low. It's at 274. Well, you can expect that because the milliequivalent total should be about 148, and it's only 137, so you'd expect it to be a little down. But there's another problem, and the problem is that darn calcium. because lots of drugs will precipitate if they're exposed to calcium. And so one of the complications in using lactated ringer solutions got to be carefully chosen, because if you're using a drug that precipitates, if you inject that drug into the IV fluids or into the line, you're going to get precipitate, and all you see is this chalky stuff going down into the vein, which will scare the living whatever out of you when you see it heading towards a vein. And it's all because they put calcium in there. So you got to be careful about that. Okay. All right. So I do here's my slide right here. Why do the manufacturers use acetate and gluconate and lactate rather than bicarbonate when they're making their IV solutions? Because we saw in the serum electrolytes that bicarbonate is about 24 milliequivalents per liter, and where is it? Not there. They put these other chemicals in there. Well, the reason is that bicarbonate is not stable, and they sterilize these fluids by heating them, with steam sterilization. And if they do that, the bicarbonate will break down into CO2 and won't be available to treat the patient to improve or to hold the pH normal. And so it turns out that acetate and gluconate and lactate are stable chemicals when heated. In other words, they'll stay the same, all right? So after they get through sterilizing it, they still got that chemical there. And the physiologists have found out that those three chemicals, acetate, gluconate, lactate, are metabolized by the liver and are converted into bicarbonate. So you're dependent on the liver to make the switch from that chemical into bicarbonate. So it's an important thing to remember that we've got to have normal or reasonable, at least reasonable liver function to have them work the way you'd expect them to work. Well, when do you use these Plasma-Lyte, Normasol, and Ringer's lactate? Well, whenever you don't know what you're doing at the moment, in other words, a patient comes in, is really sick, it's an excellent way to start, because at least what you're doing is putting something back that's about the same as plasma. You can use it to try to correct blood loss if there's been hemorrhage. You can use it when the patient's in shock to try to get the blood pressure temporarily up. Going to have to do other things, but at least you get started. And the other is if the patient has metabolic acidosis. In other words, it's lost bicarbonate for some reason. You're putting back some chemicals that will be able to buffer the blood pH, in other words, make it more towards normal, and maybe save the life of the patient while you're doing it. It's also used for daily fluid maintenance. Not perfect for that, but that's what usually is given. So another important thing is that we come up with a plan on about how much fluid to give, and here's an important thing, that if the kidneys are functioning reasonably well, you can be under and over the amount you can be over, not so much under, but you can be over the amount that's needed and just rely on the kidneys to sort it out. Kidneys are wonderful about trying to maintain plasma volume, so if the plasma volume gets too big, well, the kidney says, I got to get rid of some of this water, and out it goes. Well, you say, well, I'm wasting a little bit. But yeah, that's okay. But it's better to give a little bit more than a little less. And the kidneys are also really super great at getting rid of unneeded electrolytes. So if we get off a little bit, we give a little bit too much of any one of them, why reasonable amounts, the kidney says, oh, there's too much sodium here, I got to get rid of some. So they'll excrete some sodium. So you've got the idea. Okay. There's not much more to go here. Now, 5% dextrose injection solution. It's got a little bit of sugar in it. So dextrose is a sugar, and it's got a real complicated formula, as you can see, but it's dextrose, it's a sugar. And patients, you say, well, they need sugar. They've got to have that when they're sick. Well, yeah, they do, but they can live for a long time on the muscle and fat that's available, but it does add a little sugar. And it turns out that 5% dextrose is pretty much isotonic. It's a little low, but it's got an osmolarity of 252.